This is ASA TV. I'm Sarah Panko, and joining me now is Dr. James Grant and Dr. Mary Dale Peterson. Thanks for joining us. Let's jump right into it. So, Dr. Grant, why is ASA placing such a spotlight on physician leadership?
You know, ASA has always been focused on what's best for our patients, what's best for our specialty, what's best for our members. Healthcare is becoming incredibly complex today. It's really important that we have anesthesiologists who are really playing leadership roles in hospitals, leadership roles with the payers, leadership roles in government and regulatory agencies. If you think about what an anesthesiologist does, they do a whole host of things, but they really can touch a patient from the time they come into the hospital to sometimes 25, 30 days out. We have intensive care physicians that actually are there at when they really need them the most. We have pain physicians who are in outpatient clinics. We have anesthesiologists throughout outpatient centers throughout the country. The way anesthesiologists can touch various sectors of our system is amazing. So who better to train to become leaders to actually set the agenda than anesthesiologists?
So, Dr. Peterson, how is ASA working with the American College of Healthcare Executives to support this continued focus on leadership development?
Well, we all know that the American College of Healthcare Executives, ACHE, is a preeminent organization really for teaching physicians various skill sets. And so why not partner with one of the best to help us do this for our own physician members? I am actually a member of the American College of Healthcare Executives, and for a long time have been able to benefit from the excellent courses that they hold. And now we can actually offer this to our members. We have over 1,000 hours of potential joint ASA, CME, and ACHE credits that we can offer. Even this year in the annual meeting, we've offered the master class. And it's a full day class of really working with experts in small groups and learning the skills of negotiation, communication, and teamwork. These are the skills that our leaders need now and into the future for functioning healthcare systems or appropriate contract negotiations, whether it's with payers or with hospital systems that our members need right now. So we're very excited about that. We've also instituted a collaboration at the state levels, Indiana, Illinois, Pennsylvania, Texas, to name a few, where we are working at a local level. When you go to those ACHE meetings, you can get dual credits as well at your anesthesia meetings. So it's really an exciting partnership for us. It's the first time that ACHE has done a partnership with a physician organization like the ASA. So I really welcome all of our members to try some of the ACHE offerings, and I think you'll be just as happy as I've been over the years.
So, Dr. Grant, can you tell us a little bit more about ASA's Executive Physician Leadership Program and how it has expanded?
Well, I think you heard from Mary Dale about the programs that we have in collaboration with the American College of Healthcare Executives. They've been wonderful. Now what we've done is we've taken it to another level with the Northwestern University program. Northwestern University has a tremendous business program that really helps train future physician leaders. We partnered with them to bring anesthesiologists to the table for actually concentrated courses, discussions, lectures on what it takes to be a physician leader. They tend to be oversubscribed. We end up having many more people interested than we have spots. And now, because it's been so successful, we now have 2 tracks. One for those that are originally in, and then it's sort of a phase 2 for those that really want to hone and fine-tune their skills as physician leaders.
So are there any other new innovative leadership-related offerings that we should know about?
Yes, Sarah. So we have one more great program that I'd like to share with our ASA members, and it's the Center for Physicians Leadership Excellence. And in this program, you can do assessments and have a coach, and this is really for your individualized career development. These are tests like the Hogan and others that some of you may have experienced before, but it really tells you what your strengths and weaknesses are, and then working with a coach, that person can actually help you capitalize on your strengths and explore how you can work on your weaknesses. And so this is a great tool as you're looking for leadership positions and knowing what you're good for. So I really encourage our members to take advantage of this 7-hour online course, but with a real coach as another way of improving their leadership skills.
Mary Dale, what you said about the Center for Physician Leadership Excellence, you couldn't have been more right on. It was perfect. I actually was one of the very first people to enter into the program. And I'll tell you, as physicians, we don't want to like to hear our negatives, but we have to hear our negatives to make it positive. And I will tell you that I've seen personally and I've seen in others, the great things it's made us to become actually better leaders. So thanks for bringing that up.
Well, thank you, Jim, for being one of the first ones to be involved in that course. And, I've taken some of these tests before, and it's interesting how they say don't downplay your strengths either. Really use your strengths to propel yourself and your organization forward.
For sure. It's been great.
All right. Well, thank you, Dr. Grant. Thank you, Dr. Peterson. And thank you for joining us.